Bismillahir Rahmanir Rahim. It is my pleasure to share with you the data of our study regarding the cancer pattern among adults in Najran, Saudi Arabia, 2014-2019. From the 1,600 cases studied, we have almost 55% females and 45% males. The top 10 most common cancers, we have the breast cancer 14.2%, then the thyroid cancer 11.8, then colorectal cancer 8.4, gastric 4.8, leukemia 4.7, non-Hodgkin lymphoma the sixth position 4.6, liver cancer seventh position 4.5, head and neck the eighth position 3.5. We have the ninth position pancreas 3.4, then brain 3.3. The most common male cancers, we have the colorectal in the first position 10.2, HCC hepatocellular carcinoma the second position 6.7, leukemia in the third position 6.6%, non-Hodgkin lymphoma in the fourth position 6.2, gastric cancer fifth position 6.1, thyroid the sixth position 5.9, then head and neck 5.8 in the seventh position, then bladder cancer 5.6%, then brain 4.7, then the last among the 10 top pancreatic 4.4. For females, of course, breast cancer 25.3%, thyroid 16.7%, colorectal 7%, ovarian 5.8, gastric 3.8, uterine 3.4, non-Hodgkin 3.3, leukemia 3.1, Hodgkin 2.7, liver 2.6. The top 10 cancers in this study were breast, thyroid, colorectal, gastric, leukemia, non-Hodgkin lymphoma, liver, head and neck, pancreas, and brain. There is similarity in the incidence of breast cancer, which is the first, of course, and leukemia, which is in the fifth position, with the Saudi Cancer Registry 2015 and the Gulf Cooperation Council, GCC. Thyroid cancer as the fastest growing cancer is in terms of its incidence, it comes as the second common cancer, 11.8%, which is higher than the national Saudi national figures, which is 8.5, GCC 6.3, so we have higher thyroid. And the international figures less than that. This may be related to two factors. The first one is the overdiagnosed by the fine needle aspiration biopsy, while the second possible cause is the low iodine intake in Najran region, as shown in the meta-analysis, where a higher intake of dietary iodine was a protective factor against thyroid cancer. Although our study showed a lower incidence of the colorectal in comparison with the national figures 12.2, Najran 8.4%, we are in concordance with the GCC and the world, almost 10%. Gastric cancer ranked as the fourth, while not seen among the top 10 national cancers, but we are again in concordance with the GCC, where the gastric cancer is the eighth one, and all over the world, where is it the fifth. The most commonly diagnosed cancer worldwide is lung cancer, while our study showed low incidence of this cancer, 2.8%, also mostly as a result of the lower prevalence of tobacco smoking in Najran, in contradictory to the higher prevalence of the tobacco chewing that may explain the higher incidence of head and neck cancer, which comes in the eighth position. As a unique finding, differs from the local and world figures. Our study showed pancreatic cancer among the top 10 with global similarity, where about almost 300,000 people had pancreatic cancer in 2012 worldwide, making it the 11th most common cancer. To date, the cause of pancreatic cancer is still insufficiently known, although central risk factors have been identified, such as smoking, obesity, genetics, diabetes, diet, inactivity. Our figures are higher than the national and GCC figures that warrants further exploration. In males, the incidence of male genital system malignancies, including prostate cancer, like other Arabian Gulf and Asian countries, is very low in comparison to Western, despite the high intake of calories and high consumption of animal fat. This may be attributed to the lack of prostate screening programs. And thank you.